Hello and welcome to this special show on Rajya Sabha Television. I am Vishal Dahiya, and here we take stock of India's fight against COVID-19. Now, one of the very important aspects now that almost 3 months have passed is to adjust to the new normal. Now, what exactly is the new normal and how do we navigate through this particular new normal in these crucial times? This is something which we're going to focus on today, and for this we are joined by a distinguished panel of guests. Let me first introduce them to you, beginning with Dr. Pavan Mamidi. He is the Director of Center for Social and Behavioral Change. We also have with us Professor Srinath Reddy. He is the President of Public Health Foundation of India. And we're also joined by Urvashi Prasad, Public Policy Specialist at NITI Aayog, the think tank. We'll begin with you, Dr. Mamidi, and let's start by trying to understand and make our viewers also grasp it in a much better way. What exactly is the new normal which we keep on talking about? This is a term which is now quite famous, the new normal.
Thank you, Vishalji. Thanks for bringing me into this very distinguished panel. So the new normal is a sort of a very quick expression that has gained currency. I look at it as a new temporary normal, and this and it talks about a particular phase in our lives when we have to adjust for an ongoing pandemic with real dangers to human life, and this involves us needing to undertake behavior changes for our own safety. Mm-hmm. So new normal is not normalcy forever, but normalcy for a temporary period of time until we are able to resume our lives, in a way that we are already familiar with.
Okay. Urvashi, there's this new campaign which NITI Aayog has started with the Center for Social and Behavior Change and the Ministry of Health and Women and Child Development Ministry as well, and some other organizations also involved there. What exactly is this campaign about when we say navigating the new normal? What are the focus? What is the focus here? Behavioral aspect, as Dr. Mamidi was pointing out, or something else as well?
So there's sort of two major components to this campaign. One is there is a web portal which is live now, which has good resources. There's in the form of visuals, in the form of videos, on how we can nudge people. Nudge is another term which is used frequently in sort of behavioral theory, but it's simply put, it's just trying to push people towards desirable behaviors at this time. So whether it is wearing a mask, whether it is maintaining physical distance with people around you, and how do we do this in different sectors, because we have health facilities, we have our Anganwadi centers, we also have some public transport which is now opening up. The metro might start in several different places. Other types of public transport has already opened up. So how do we in each of these different sectors really try to encourage people and keep reminding them? It's sort of like reinforcing the messages that keep going out, that you need to wear a face cover or you need to maintain hand hygiene. So in very simple audio visual ways, trying to encourage people to follow these behaviors, because that is really what will continue to sort of save lives into the future as we unlock. We know we can't be in lockdown forever. So that is one sort of repository of resources. The other is a media campaign, and we would have seen the video also. It's been shared on social media, various other places, which is focused on wearing masks, wearing face covers. So it's basically encouraging people that if you see somebody around you who's not wearing a mask or a face cover, do try to nudge them, do encourage them to do this, because ultimately your health is only as protected as that of the person in front of you or the people around you. So if you're wearing a face cover, but people around you are sort of much more lax, somewhere it will start to impact other people as well. So I think trying to bring in this sort of sense of community, and that you're not just protecting your health, but also those of others around you who might actually be much more vulnerable to the virus and to the infection. So those are sort of the two broad sort of components of this campaign.
Okay. Professor Srinath Reddy, your views on the concept of new normal and the entire exercise of navigating through this new normal.
Well, I would say there are three critical elements to this: care, caution, and confidence. Care in terms of personal protection, making sure that you are physically distanced, wear masks, and practice hand hygiene on a regular basis. Caution avoiding crowded places like malls or even large congregations, whether they are social or religious, not partying at lib in a very unprotected environment. So those are the cautionary elements that we need to exercise. Confidence that we can resume a lot of our productive work and even social engagement with others while observing some of these precautions, whether we are doing work from home or work in office, or whether we are using transport. We have to observe certain norms and ensure that we can actually resume our activities with confidence, but while observing personal care as well as caution in terms of mingling.
Okay. Okay. So these are three different aspects. Let me go back to Dr. Mamidi here. Dr. Mamidi, as Urvashi also spoke about the two-pronged strategy there as far as this particular campaign is concerned. Let's start from the behavioral aspect. How does an individual goes ahead and bring those changes which are required? One, and two, overall, as a society, what needs to be done?
Yeah. So one fundamental thing that has happened on account of this campaign is that it recognizes that behavior change is not necessarily the responsibility only of the government. Because, I mean, at least during the pendency of the lockdown, the government was enabling the safe behavior by getting people to be indoors. But now, once you withdraw the lockdown, now you're expecting the people to self-govern. So the big behavior change that is required is getting people to become responsible for themselves. So the first critical piece in the 4R model that we developed at CSBC, which NITI Aayog has adopted in its campaign, is the responsibility transfer from the government to private citizenry. The second component that is needed for the behavior change is the reminder that there are some norms that are prevalent and that need to be avoided. So every time you get into a train, somebody doesn't wear a mask. Maybe the person is not deliberately not wearing the mask, but the person has forgotten to wear the mask. So reminding the person that there is a norm or an expectation, I think that becomes the second R. So it's the reminder. Third one is a mild reprimand. That's the third R, where if the person has deliberately avoiding a safe behavior, then you kind of raise your voice a little bit or use self-indignation to indicate that this is not done, this is not good. And the fourth one is to do it respectfully, in much the same way that an airline flight crew would tell a passenger to wear a seatbelt, to remind the person that the seatbelt is important. And if the person doesn't wear it, say it in a slightly elevated voice so that you draw the attention of your fellow community members to impose some social expected cost for the person to comply to the behavior. So the behavioral change comes from not from the government, but from enforcement within the community. That is the sort of the key intuition behind this campaign.
Okay, and as a society, as a community, this is obviously once the individuals start doing it, everybody will form a group or form a community, and then this will show results. But if you look at as a society, the social changes which we are aspiring here, behavioral changes is one aspect. Do we expect that these 4R or 3C formula, which Dr. Reddy also spoke about, they themselves will work, or is there some nudge, as Urvashi was pointing out, is also around the corner or on the plate out there?
So it is never insufficient for us to depend on social norms in isolation. Social norms should be enabled by formal institutions, by formal laws, right? In as much as formal institutions need to be enabled by social norms. So we've just if we were to depend purely on social norms, then we would have to get rid of the government. We don't need it, but that's not true. We still need the government. So I think it's jointly, it's formal institutions and informal institutions that jointly can enable this safe behavior. And that is the key piece. But the most important thing in delegating responsibility to private individuals is to ensure that the private individuals don't behave in an irresponsible manner, that it doesn't lead to vigilantism, it doesn't lead to conflict, because now suddenly you have your neighbor telling you what to do, should not lead to a fight with your neighbor. So how do you sort of monitor those social norms in such a way that you have responsible behavior but without conflict in society is the key challenge.
Okay, so the rules are already there, the guidelines are already there. It's
That's
about
right.
bringing that inherent change within yourself and become that agent of change to try and ensure that the overall format or overall the concept of navigating the new normal is done. Urvashi, your views on this joint collaborative effort between the society, the individual, and the government as well.
Yeah, I think it's as the panelists have been saying, that during the lockdown phase, the government, was perhaps playing a disproportionate role, and to some extent, right at the beginning of the pandemic, something quite unknown, not something that people were familiar with, that was also required. But now, as we are moving forward and we're realizing that this is something that perhaps will be with us for a while, and that's the experience we are getting globally as well. Every sort of constituency needs to really come together and play its role. So I think the government by no means can sort of say that their role is over. That has to very much continue, and I think that will continue as well in the form of different sort of monitoring mechanisms, guidelines, etc. I mean, these are evolving constantly because we are also learning something new about this as we go along. So we are seeing constant, sort of evolution in that. So that will very much stay. But I think individual citizens, communities, employers and workplaces, I think that is becoming a very important constituency now, because different types of workplaces are opening up, different types of factories are starting, offices of different kinds are starting. So I think in each context, we're going to really be learning how do we adhere to some of these norms and what works best in each of those contexts. So I think going forward, it will have to be very much a collaboration between all three. Some of it will be, enforcement, monitoring, but a lot of it will be, people doing it themselves, encouraging each other to do it, that, it's not just for you, but it's for those around you, the most vulnerable around you. So I think these are the kinds of messages that will need to go out. And I think community ownership, which is what was talked about, does become very important. We saw this in Swachh Bharat as well. That always the government telling people what to do often doesn't work. Even if you're giving people a free toilet, people often don't want it or they don't really value it. But when it comes from the community themselves, when it's a felt need, when it's seen as something socially desirable, it has a much better impact. Of course, there is an extreme side to that as well. We saw in some cases, if you don't have a toilet, there's some sort of unnecessary sort of force being used on those households or those people. So that, of course, has to be avoided in this context as well. Everybody can't become a sort of a vigilant. But there has to be some sort of positive, just reinforcement and positive sort of social desirability elements brought in here, that if you do this, you are a responsible citizen. You are a conscious citizen. And I think that's something that the Prime Minister also keeps repeating in his messaging during his various Mann Ki Baat addresses, etc. That it doesn't mean if you're wearing a mask, you are a sick individual. It just means you're a conscious, responsible citizen. So I think, these messages, will constantly need to keep coming to help us sort of tide over this new normal, as we call it. But it will very much be a collaboration, cooperation amongst all these different constituencies from here on in.
Okay. Professor Reddy, your views on the collaboration part out there, and the 4R formula, which NITI Aayog has adopted from the CSBC, that is about responsibility, reminder, reprimand, and respectfully doing that reprimand as well. So how does that help in terms of ensuring that joint effort?
It is absolutely necessary to adopt all of these if we have to succeed. During the period of lockdown, it was imposed or enforced discipline. Post-lockdown, it is adopted personal discipline from conviction. And you definitely have to have the people fully embracing this concept and adopting it in their personal lives, family lives, as well as in their work environments. Otherwise, we are not likely to succeed. The fear of the danda will only go a little way. People will then try and escape whenever they get a chance. And we have seen that this has worked. We have seen it work in Dharavi. People all over the world said, oh, in Dharavi we are going to have a collapse of the
Absolutely.
system because of the crowding. But the people agreed to whatever difficulties they had with physical distancing, but at least in terms of masks and hand hygiene and cooperating with various kind of health checks, they came forth most willingly. Similarly, in the villages in Gurgaon, around Gurgaon, while the city itself is teeming with cases, the villages have been remarkably successful because the panchayats have built a social consensus around it. So I think it is absolutely important at this stage to bring in the public, both in terms of panchayats, elected local bodies, self-help groups, citizen representatives, NGOs, and make it actually a popular adopted norm. I would say actually we need a new PPP, not the typical public-private partnership, but a people-partnered public health.
Mm-hmm. That's very interesting term, and then very significant here as well. People partnered public health. Dr. Mamidi, on the focus part, for this particular campaign, in terms of what will be the focus areas, the sector specifically. Urvashi in her first response spoke about healthcare, public transport. So what are the focus areas apart from that, and how? What's the plan to go ahead and navigate through these focus areas?
So there are a diverse set of contexts. I mean, ranging from the little workshop on the side of a street to a big factory and so on. Oftentimes, one feels that privately owned spaces have their incentives aligned towards compliant behavior, right? So norms there naturally evolve to safe behaviors. So you don't really need to do much there. But in spaces where social distancing is impossible, the least that you can get people to do is mask wearing. I mean, Professor Reddy brought in the example of Dharavi. I mean, Dharavi, the density is so high. To even ask for social distancing might be seen as an affront to a person's dignity there, because I mean, you're challenging their socioeconomic status in some sense. So one needs to sort of draw distinctions between these different spaces and monitor or formulate norms which are individual context specific to each of these. It becomes very, very important.
Okay.
So if you were in a bus, for instance, social distancing is impossible. But at least the least that you can do is get a mask, get mask wearing to be important there. Hand washing is the toughest one because hand washing typically happens within the confines of your home. You can't monitor that behavior. So how do you enforce that behavior? So I think one needs to focus on behaviors which are visible, which can be monitored, and the cost of enforcing that behavior is less. And the enforcement is not by the government, but the enforcement is private, and it is done in a respectful manner without leading to conflict. So there is a high degree of variation across contexts, and you need to calibrate these norms according to these different spaces.
Okay, so it has to be a contextual implementation out there in terms of how we do it and where we do it as well. Urvashi, your views on this contextual implementation part, and also, now that we're in the last leg of the discussion, what exactly would you try to convey to individuals, to the citizens, in terms of what should be done, what should not be done?
Yeah, so I think to your first question, I think the context is absolutely very, very important. And I think we were having an interaction with the Chief Secretary of Haryana recently, and she was mentioning just this, that when you're talking of workplaces opening up or factories opening up, manufacturing might be very different context from construction, might be very different from something else. So how do we apply these standard norms? We do have certain standard norms of distancing and face covers and hand hygiene, but how do we really apply these to each of these contexts? And I think this is perhaps a role which the government can play a bit of an enabling role here, to, as we keep learning from these different industries, different sectors, to come up with some sort of basic set of standard operating procedures which can be shared across and adapted to the local context. But I think this is something that might be quite useful as we move into unlock 1, because a lot of states into unlock 2, because a lot of states are coming up with this feedback that these standard norms are fine, but how do we really apply these in our very different context that we are seeing? So I think that is one thing that we would need to focus on. And I think to citizens, to communities, I think, as I said, the standard messages are pretty clear. They've gone out several times. They'll continue to go out through exactly such campaigns, which are very, very effective in conveying these messages, and they're designed by experts who are well versed with behavioral theory, etc. But I think really the ownership, the change when it comes from within people will be the most effective. We are seeing this with the social stigma part of it as well. It's one thing for the government to say, we can take penal action against you if if there's acts of violence against health workers or others. But it's one thing for people themselves to say that, look, this is not something that we should be doing. These are people saving our lives, or these are just patients. There's no need to stigmatize them. So I think even in this, and we're seeing a lot of good practices emerging, a lot of civil society organizations also doing very good work on this. And I think we'll need to really try to scale these up, replicate these, because these are changes coming from within people, rather than just some sort of penalty or some sort of rules being imposed by the government. So I think those would be the key points to sort of round up with.
Okay, Dr. Reddy, as a public health, expert, your advice, or rather your message in terms of do's and don't for the general citizen, general individual in this society, because it's ultimately what an individual does which will affect the community, the society, and the country as a whole.
Well, we have already discussed what people need to do for personal protection, protecting the families as well as protecting others as well. But I think the context-specific nature of the recommendations has to be emphasized again, because what we are likely to plan for schools and colleges is going to be different from the factory floor, and that's going to be different from a usual working office. For a simple thing, in a working office, you want to plan the route in such a way on the floor that people will only move clockwise or anti-clockwise and don't bump into each other, apart from spacing out the desks. So, and what do you do with the washrooms? How do you actually maintain that kind of a distancing as well as hygiene in the washrooms? So these are things that need to be planned meticulously at each level. And I think the local stakeholders are the people who will also actually come up with innovative and ingenious ideas. And therefore, I think their participation in the planning is going to be very important and contextually oriented. So I think the general exhortation to maintain safety is something that we must emphasize, but leave it to the creativity of the actual stakeholders to come up with practical solutions.
Okay. Dr. Mamidi, your concluding comments there before we bring the show to an end?
I think the emphasis of this, one key thing to notice about this campaign by NITI Aayog, which we partnered with on, is that the cost-benefit analysis, I mean, it tells us that making private enforcers is a lot easier than private compliers. And so most of the messaging, if you notice, is directed towards getting people to enforce other people's behavior. And one of the things that we have leveraged is the use of children as people telling, Uncle G or Auntie G, you're not behaving in an appropriate manner. You should be behaving in the right way. So there's a moral force to a child saying that. And there's also sort of the responsibility that has been transferred to an individual in society. That is the key thing. I think that is the key to success in ramping up social norms very quickly and rapidly.
Okay. Thank you so much, Dr. Mamidi out there, Urvashi, and Professor Reddy there as well for sharing your views on this very important aspect. As our panelists pointed out, it is all about us becoming the agents of change, but that will have to be done in a very proper manner. All of us cannot end up becoming social vigilantes. There are certain rules and norms which we will have to abide by, and we should first follow them and then request others as well to follow the same norms or same guidelines. And as one of our panelists said, it is about PPP, people's participation in public health, contextual implementation by the authorities as well and by the individuals also. We'll come back again with a different topic. Till then, you keep watching Rajya Sabha television, and once again, we'll leave you with some advice, that is, do not step out of your house without a face mask, and please follow all the norms with respect to social distancing. Thank you.